Good afternoon. I'm Dr. Nagraj from IIP Digital Media Team. I'll be host for today's webinar on the occasion of World Health Day with resource person Dr. M. Sandhya and Dr. Koushik Kumar, being organized by IIP Women's Cell Kanchipuram District, Tamil Nadu. Before we start, I would like to briefly introduce about our IIP Digital team. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IIP Digital team consists of group of physios who handle Zoom platform, webinar live streaming, and IIP profiles on social media platforms like Facebook, Instagram, Twitter, LinkedIn, in YouTube. Follow IIP profiles on these social media to receive notifications for our events such as webinars, workshops, CMEs, and conference, health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IIP YouTube channel for notifications of our live webinars. In playlist session of this channel, webinars are segregated into various folders on topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health, research, cancer rehab, etc. For easy access, the social media links will be shared in the chat shortly. So without much wasting time, I'll try to hand over the session to Dr. Pradeepa ma'am. Thank you.
Thank you. Very good afternoon to everybody over here. I'm Kanchipuram district and I'm the district coordinator. So wishing you all a World Health Day. And today we all are here for the webinar the topic emerging trends and practices in orthopedic physiotherapy. And I'd like to welcome Meher from Association of Physiotherapy, physiotherapist, and Dr. Ruchivashini ma'am, our National Head of Indian Association of Physiotherapy Women's Cell and Treasurer of IAP. Dr. Janani ma'am, our State Head, Tamil Nadu IAPWC. I would like to welcome all our students and professional participants for this webinar. First resource person of this hour will be introduced by our sub-coordinator, Dr. Chandralekha ma'am, Kanchipuram district.
Thank you, Pradeepa ma'am.
Chandralekha ma'am, I'm handing over the session to you to introduce our first resource person.
Yes, madam. Thank you. Thank you, Pradeepa ma'am. Good afternoon, everyone. Am I audible, ma'am?
Yes, ma'am.
Good afternoon, everyone. I'm welcoming you all for webinar. Happy World Health Day to everyone. It's my pleasure to welcome Dr. Koushik Kumar sir. He has 13 years of experience in teaching, academic teaching line, 4 years of clinical experience in Tribulum Super Specialty Hospital in specialty on cardiac ICU and cardiac rehabilitation department. He has a visiting specialty consultant for cardiopulmonary respiratory rehabilitation in private hospital all over Chennai. He has research contribution published in 7 publications, ongoing process in 2 publications. Currently, sir is working as a professor in Faculty of Physiotherapy, Meenakshi Academy of Higher Education and Research Institution, as a specialty of Department of Cardiopulmonary and Science. I am welcoming you, sir, to learn about the hybrid of cardiorespiratory rehabilitation thing. Thank you so much to everyone, all of my mentors. Sir, it's over to you.
Thank you, ma'am. Thank you all. So, very good afternoon, all. And today is the World Health Day for 2024. The theme is My Health and My Right. So, the people should understand about the health and as well as their own rights. And just I'm sharing my screen. So, the World Health Day 2024 theme is My Health, My Right. So, as the theme of the World Health Day 2024, which focuses on fundamental human rights, access to quality healthcare, education, and in information. So, we have 5 quotes about the World Health Day. The first thing is nourish your body. Number 2 is exercise as well. Number 3, prioritize sleep, get regular health checkups, pay attention to your mental health. So these are the 5 quotes. Very importantly, we should think about the during the World Health Day. Okay, so coming to the topic like a hybrid approach of cardiac rehabilitation. So basically, we all know about the cardiac rehabilitation. What does the cardiac rehabilitation means? So cardiac rehabilitation is a supervised program that includes physical activity, education about the health living, including how to eat healthy and take a medicine, and how to, do you have to quit smoking, counseling to find the ways to release the stress and improve the mental health. And historically, cardiac rehabilitation was offered mainly to people recovering from the MI, but now encompasses a wide range of cardiac problems. So we have to think a lot about the cardiac rehabilitation. So according to WHO and American Heart Association, we have so many definitions are there. So exercise counseling and training, and educations of heart healthy living, and counseling to reduce stress. So these are the basic definitions, but it should reach. But I think it doesn't reach properly to the general public, and as well as some healthcare providers also, because see, so many nowadays we can see that so many people are getting into a trouble of cardiac, maybe in even some limelight people also may have get to an issue in cardiac and cardiac problems. So these are the factors for the cardiac rehabilitations, that is the myocardial infarctions and the revascularization procedures like angio, like PTCA and CABG, and controlled heart failures. So usually after the procedures or after the medications, the people will take a cardiac rehabilitation, cardiovascular rehabilitations, and we have to insist that CAD is also one of the basic criteria to get into a cardiac rehabilitation. So separate programs will be provided for the people with the different diagnosis. The approach adopted will address the differing needs of these groups. The people with other presenting problems such as comorbid, that is a long term of diabetes, long term of hypertensive, and multiple risk factors may also participate. They should also participate in the cardiac rehabilitation based on the needs of the core groups. And so these are the a basic medical goal to improve the cardiac function. The social goal is to return to the work appropriately, or maybe to the maybe mm, early back to the work, or psychologically to restore the self confidence. Behavioral seems to be to quit all forms of smoking, and the health service goals to directly reduce the medical costs, etc. So these are all the basic things we know, but since we have so many things to undergo, so we will see it in the coming slides. So who are the members in the cardiac team, I mean cardiac rehabilitation team? Cardiologists, physicians, and clinical nurse specialists, physiotherapists, clinical nutritionists, occupational therapists, pharmacists, clinical psychologists, and social workers. And as you all know, and as well as it's a basic thing, we all know about the phases of cardiac rehabilitation. That means the phase one is an inpatient rehabilitation. So usually during the hospitalization, or maybe during the person in ICU, the patients will undergo the first level of cardiac rehabilitation. And phase two is seems to be like an outpatient, or maybe a early discharge, or a outpatient phase rehabilitation. And three is a community setting, or a community formation rehabilitation. And the fourth thing is a long-term management, or maybe a follow-up kind of a cardiac rehabilitation.
நான் ரமணியாக்கு வந்தா கொடுத்துருடாங்க அவங்க phone.
So the goals of phases means access mobility, and affects the basic functional mobility as on cardiovascular system. close working with doctors, nurse, and other therapists to ensure the appropriate discharge planning, and prescribe the safe exercises, help maintain external precautions, address any risk factors that need to be a cardiac events during the rehabilitation phase, and prescribe appropriate assistive devices such as walker or walking sticks during the rehabilitation phases, and very mainly the education sessions with the information, the cardiac events, psychological reactions. So these are all should be made a short-term goal for the cardiac rehabilitation. And the phase in during the phase one, we will always we will monitor the patient closely from the ICU to the to the wards, as well as and we will make a group sessions or a group rehabilitation in the ward. We'll make the patient to walk, and we'll stabilize the patient till the patient is getting discharged. So come the patient will be a complete monitor during this phase. And the phase two, from the phase two, the actual hybrid rehabilitation should start, because all these first phase one seems to be like it is like the patient will be in a complete close monitoring. So no need to worry about any the extra events log, or maybe any side effects, or maybe any misleads. So better understanding of how to keep the heart healthy is emphasized. Check the patient's medical status and continue the recovery. And a structured program should be advised for the patient, and supervised exercises should be given. Counseling and reinforcement of knowledge and lifestyle modification for the secondary prevention. Structured patient empowerment and self-help program should be teach to the patient. So during discharge, we have to advise, or we have to give a counseling session for the patient to what to take and what not to take. A complete program of, or maybe we should be a complete life coach for the patient. And the assessment and review should be undergone, like individual assessment and regular review should be undergone, like a low or moderate intensity physical activity. So we should teach them, and we should teach them about the physical activity. So how to perform the activity, or how to perform the exercise, or else how to perform the normal ADL activities. So so in ADL activities, nothing will happen, because almost they will get trained during the hospital period. But only thing is how to do the exercises, or how to maintain the exercise program. That is seems to be somewhat tough for the patients. So can include a supervised group or individual program, including warm up and cool down, catering to the individual needs and capacities of each patient. Resistance training and appropriate and written guidelines for the resumption of the daily activity. So we should write the patient what to do regularly. So daily they should take a, daily intake of, timings, food timings, and as well as exercise timings, walking timings. Then they should note down the activity level. So they should they should keep on following the instruction what we have given. And finally, during the follow up, they will provide the notebook, so that we can see the activity levels. So, an education and discussion of and counseling should be undergone during the phase two. So, the effects of heart diseases, healing process, and smoking cessation should be there, and control of lipids and weight control, weight management should be there. BP and diabetes should be there. High risk, the risk factors of the heart disease, or modification or ongoing prevention should be there, and support skill development to enable the behavioral change and maintenance, and psychological issues like mood, emotions, and sleep disturbances. If it is if it is there, and we should teach them how to overcome it, or otherwise, definitely they have to call us, or they have to call the specific person to get into, to overcome it. And the social factors like a family and personal relationship may also get affected, so that they need to undergo a counseling for that, and they have to rule out all the issues what they are having. And coming to the point, like exercise prescription during the phase two. So in phase two, the very important part is like exercise prescriptions. So like what kind of exercise we can teach them, and what type of exercise they should undergo. So the both aerobic exercise and resistant exercises training increase cardiovascular function and muscular performance by stressing on transiently overloading the respective systems. So they have to undergo both the aerobic and resistance training. Some people are thinking like simply they doing aerobic exercise will make the heart healthy. Definitely yes, the aerobic exercise will make the heart healthy, but even though the resistance exercise, we have to concentrate more on the muscle mass. So resistance exercise is also equally important. To maintain the cardiovascular function, but how to do and how much the load they can handle. So that is very important for the cardiac patients. The most exercise training studies in cardiac patients have patients exercise at least thrice weekly for at least 20 minutes at heart rate corresponding to 70 to 80% of maximum heart rate. So this is very very important thing, that the maximum heart rate. So that we should teach the patient. So what is mean by what is maximum heart rate? What is minimal heart rate? So minimal heart rate is the resting heart rate, approximately 70 to 80 beats per minute. But maximal heart rate means it's completely a different scenario. We should teach them as it's a 220 minus age. So approximately, if the person is 60 years, means the heart rate should never reach maybe at least 180 or 170. So the maximum heart rate. So if at all the maximum heart rate is like 170 or 160, so the person should reach at least a 160 or 150. So you should not reach till the maximal heart rate. Before the maximal heart rate, that means 80% is more than enough. 80 to 85% is more than enough to maintain the corresponding heart rate. Although the lower intensities produce the training response, so this will create a very good response for the patients, and this seems to be a safer zone. So always monitor the heart rate during exercises. So we have so many gadgets now, so we can able to monitor it well, and we can continue it also. So coming to the classification of physical activity intensity, during the hospital phase, we are concentrating more on the METs. So the mostly the METs will be starting from a 2.5 to 3.5 and progress to 5 METs before getting discharged. So 5 METs means the patient is can able to walk in and around the corridor. They can able to go to the toilets and come back, and the self care activities and all covers till 5 METs. So so that is not a life actually. So they have to lead a very active life, means they have to go with the further meds. So that we have a table column for this. So endurance type of exercise means relativity. The intensity should be low, like respiratory descriptions will increase breath rate 20 to 30, 39 of year to max, and the heart rate will be 35 to 55% can get increased. And the beats seems to be like if you tell the patient is middle age, 40 to 64 means the meds you can go with like 2 to 3.9 meds. In older age, above 65, like above 65 to 70 or 80 years means we can go with slowly, progressively like 1.6 to 3.1 slow. And for the strength type of exercise, that is a resistance exercise, the maximum voluntary contraction seems to be 30 to 49%. So like this, we can get into harder phases from the lower phases to we can fix up to till the moderate phase, and as well as we can reach the harder phase also. So the patient should not exercise as if they are generally unwell. So usually the patient should think like at least weekly thrice we should go undergo the exercises. So suppose if the patient having a problem with somewhat allergic, or maybe if they feel very unwell, definitely they have to quit on the particular day. So there is not necessarily there is no protocol like daily they should undergo the exercises like that. So if the patient having any fever or acute systemic illness, they can relax on that day. So unresolved unstable angina. So angina means after post-operative, the angina may the simple sternal pain may mimic like an angina. So they have no need to stress themselves for the exercises during this period. Okay. Then resting BPs are almost 200 mmHg. If it is like more, definitely we have to stop the exercises. So at least for 2 or 3 days. Significant drop in BP and resting uncontrolled tachycardia and uncontrolled trial of ventricular arrhythmias and recurrent symptom of breathlessness, unstable heart failure, or unstable uncontrolled diabetes. We have to stop with it. And coming to the phase 3. This is a commonest community based rehabilitation, that is a psychological support menu based approach. And menu based approach means what type of community we are finding, or the patient is liking, which we have to arrange that community based rehabilitation. Education and training and smoking cessation, regular exercises, and exercise will be monitored by through any phase, through any sort of a multimedia, or maybe a follow, and weight management, vocational rehabilitation, and peer support. And phase four is like a maintenance phase. The goal facilitate a long-term maintenance of lifestyle changes, monitoring risk factor changes, and secondary preventions. Options are like the education of the education sessions, and educating this is the main criteria for maintenance. During the maintenance phase, we should educate them what is actually the exercise, and what cause. If at all. So the myths are going around. If I do more number of exercises, more exercises, if I may worsen my heart. So it is not like that. We should teach them the appropriate exercises by, and as well as the exercise should be monitored by the professionals like physiotherapists. And the support groups and the telephone follow-up should be there, review in clinics, and then follow-up should be depending upon the patients, and outreach programs. So we can ask the patient to get into a like outreach programs, or we should make arrangements for the outreach like we can make a program in the park, or maybe in somewhere in open area, so that all the patients will come and have a good get together over there, and they can able to talk with them, talk to the other each others, and they will get well and out of there. And once a while we can make that like that. Every 6 months, or monthly once, or yearly once also. It's a very good motivation for the patient. And phase four exercise program organized by community group, example NGOs. So many NGOs are there to organize these programs, especially Lions Club, and links with the GP and primary healthcare team, like the family doctors, so that even we can get a very good feedback about the patients from the GPs. Ongoing involvement of the partners and spouse and families. So we should the patient should update the ongoing events in the social medias, or maybe in the community group, so that everyone will understand about the healthy lifestyles of the patients. And coming to the cardiac rehab program, and this is a very short a short rehab program. So like a dream, like D for diet, and R for relaxation, and D for exercises, A for attitudes of the patient, and M for medical management, so medicines. So these are all things they should undergo. And these dream is they should think a lot, and they should maintain all these uh, five things in the life. And coming to the point, like what is mean by hybrid variety of rehabilitations? Yes, and nowadays we have to follow the hybrid varieties, hybrid rehabilitation, because see, the patient is not coming regular follow for the hospital or to the clinic, because they think like, I am okay, I am recovered. Even the CAD patients also thinking like, okay, I feel better like after taking a medicine. So maybe they can see some a couple of YouTube videos, and they start doing the exercises. No, that is not a scenario. Always the exercise should be done under supervision. So CBCR, the face-to-face interactions with the supervised exercise. CBCR is like a center-based rehabilitation. So that if the maybe if the physiotherapists are leading this rehabilitation, definitely he has to think a lot about this rehabilitation phases, and types of rehabilitation. And depending upon the patient, we should put the patient in a phases. So if the patient require a center based rehabilitation, definitely we should make the patient to come to the center, and we should ask the patient to come to the nearby centers. Or else we can organize a center nearby the areas, like local physiotherapists who having a clinic over there. We should refer the patient to them, and they will monitor the patient, and they will take care of the exercises programs. Or otherwise, you can give a program, they will they will have a very good follow up with the patient, and they will give a report to the leading physiotherapist. So the face to face interactions with the supervised exercises, training sessions, or center based programs in the home based cardiac rehabilitation, it's a natural environment. Sometimes we physiotherapists has to walk into the to the patient's home, and we should provide a rehabilitation program. This is not daily mandatorily program. It is like weekly once. Also, we can visit the patient house, and we can instruct the patient to do all the exercise what we have given. And hybrid CRC is a in-person synchronizes real-time audio-visual cardiac rehabilitation and other local locations too. If the patient location is too far, or maybe the patient's location is out of the stations, or maybe in some other areas also, like they should undergo the hybrid variety, like like a tele rehabilitation, or maybe a supervised tele rehabilitation. Like the patient will connect with the either with a Zoom or maybe Google Meet or WhatsApp video, whichever convenient, and they will give a follow up, they will give a feedback, or else the treatment or the rehabilitation will be over maybe supervised through the video, so that the patient will almost they will do the exercises regularly in a proper time. And the remote CR, that is asynchronizes are non-communicating in a regular basis. So in for that patients, we have to synchronize the gadgets with the apps. Okay, so we have so many apps are there, so that we can monitor the patient from by through app, so that the patient whether they're doing exercise or not, or we can monitor the patient heart rate, and as well as the ECG is also, so that we can able to understand the patient's problems, and we can able to monitor well, so that if another patient is not following the instructions, and immediately we can give a message, or we can mail them that you are not in a proper way, you means you are not in a proper process of rehabilitation. And more digital technologies and telemedicine, telehealth. So tele-rehabilitation, supervised rehabilitation is a hybrid variety of rehabilitation nowadays. So we have so many things. Different barriers may have hindered a patient from doing center-based rehabilitations, because in center-based means the patient can tell so many excuses, like long distance travels. I'm not able to come to the hospital. I'm not able to walk in regularly, or maybe conflicts with the work. So I have to, if being a breadwinner, he has to work for at least 9 to 10 hours, and the family obligations. If the patient have made some commitment, so they may not come to the to visit the hospital regularly. And even the pandemic also one of the reasons. The patient monitor with their vital signs on their own during a home exercise. In hybrid variety, the patient can able to monitor the vital signs on their own during the home exercises, and record data with the wearable sensors like a smart watches, and upload data for analysis. For her daily, the data will be analyzed by the physiotherapist, and the patient should also send the data through either through WhatsApp, or maybe through the app, whichever they have, or else we should teach them how to send the data. Follow patients with a phone calls or a video live chat. So we can have a group call, or maybe an individual call, and we should mention the timings, so that each and every patient will give their opinion about the exercises, and we can able to monitor. We can able to give a proper follow by one, so that the interactions will be. Will seen by maybe other patients also, so that they can get more questions, and they will be cleared at the end of the session. They'll get cleared. So this will be initially this can be continued for at least for daily sessions, and slowly we can wean it, and every week follow up or every monthly follow up also can be done. But if at all the patient sending the data. So example, the software is like for tracking the BP, heart rate, and respiratory rate, ECG, and oxygen saturation, temperature, distance, what distance they have walked, and what are the timings of the walking, even the intensity of the exercise also we can able to monitor, and even the resistance also we can able to calculate. We can able to monitor it by seeing some gadgets like a. So this is not a branding. Like I'm just going to give you an example, like a Polar Smart tracking, Doctor Cardio tracking devices, like a Fitbit Sense. So these are the gadgets, a few gadgets that the patient has to undergo during the hybrid variety of rehabilitation, so that we can able to monitor well and in a clear way. So these are the workout details I'm sharing in the screen. Like we can able to monitor the exact timings, how many steps they have undergone. Especially we can see the maximal heart rate. So what is the timing of the exercise, intensity of the exercise, and what is the maximum heart rate they have reached. So that we can able to stabilize the patient, or we can able to uh, control the patient. So I mean the intensity of the exercise, especially we have to reduce the distance, or you have to reduce the resistance, or you have to reduce the weight, like that. Even ECG also, see if we have some, if the patient's having some variation, some sort of variations, we have to ask the patient to, okay, please walk into the hospital, so that we have to undergo the test, and maybe after that we can continue this. See, these workout details is not only for post-operative patients, even CAD, or even a suspectable patient, like a strong family history of cardiac disease, heart disease. Also, the patient should undergo the exercises with monitoring. So always the patient undergoing, the person undergoing the exercise on under monitor, definitely they will be in a safer zone. Uh, Self-monitoring, online record, and feedbacks are there. Maybe we can allow them to do all these things. Allow patient to record the vital signs and exercise types after each sessions. A record of the self motivation levels, even which they can record by by sending the message, or maybe like voice message on, and as well as text messages. The patient requires a better understanding of their illness and manage their conditions. So the target patients, who are the target? And we can't say the patients, the target patients as well as an audience. The cardiac patients with a low to moderate risk, who who can self-monitor body conditions during home exercises. So these are the conditions only the patient can able to reach the 5 minutes. At least they can do their own activities. Definitely they are in the hybrid variety. Otherwise, we can go with the age. I mean, the strong family history of cardiac disease, or a comorbidity, maybe a long term of diabetes, long term of hypertension patients also can undergo the hybrid variety of cardiac rehabilitation. So it is not cardiac rehabilitation is not only for the patient, even for the normal person also require the cardiac rehabilitation after 40 to after 50, because nowadays we can see so many uncertain problems are happening in the around the area. So we can see the sudden cardiac arrest, or maybe heart attacks, or symptomatically cardiac problems are there. So always do the exercises with proper monitoring, and keep in mind the maximal heart rate seems to be very important. They should not reach the maximal heart rate. Before the maximal heart rate, there is a 70% or a 75%, or 80%. The maximum the heart rate should reach like 80% of maximal heart rate is more than enough. So that before that they can maintain the 80% of maximal heart rate, and they can continue doing at least for a 20 to 25 minutes. That seems to be a very optimal level of exercises for the person. So usually the inclusion criteria is like post cardiac surgeries, like post BCI, post angio, and a stable HF, and normal submaximal treadmill stress test, and possess the smartphones and watches literates. All will be in inclusive criterias. And the logistics, like it is like uh, the problem is like the mobility is the main logistic problems for the person. So that's why we are motivating the hybrid variety of cardiac rehabilitation. And coming to the rehabilitation of a model, it's like eligible cardiac rehabilitation patients, and cardiac rehabilitation intake assessment visits will be undergone and we can categorize the patients in level 1, 2, and 3. So one is seems to be can attend at least 12 sessions, can attend at least less than 12, and cannot attend the center base. So we are categorizing three levels of patients. One is like regularly can able to come and do, and after a couple of sessions, 12 to 15 sessions, they will go for a hybrid. And number two is like they can't able to continue at least the 2 or 3 sessions, not more than that. Then they will ask for a cardiac rehabilitation. Number three is definitely after a discharge, they will never turn back to the hospital. They want to be they want to sit in the home, or maybe in the or because of the commitment, they may not come back to the hospital. So they also require a hybrid rehabilitation. So we are categorizing in 3 levels. The home-based rehabilitation program as self-management tool, improve the complaints of and outcomes. The fewer on-site sessions augmented. So number 2 is like we can make the home visits at least quite weekly ones or 15 days once, so we can teach them what to do and how to do it, and we can make them put it into a home-based cardiac rehabilitation program. Number 3 is like receive a complete home-based program. So initially, we have to walk into the patient's home. We should teach them at least 4 or 5 sessions of cardiac rehabilitation programs, and we can make them we can have a good feedback from the patients, like maybe like a hybrid variety, and we'll see we can able to monitor them in as well. And some equipments like polar fitness watches and maybe some we have to follow the safety goals, like to observe for abnormal BP, heart rate, and rate of perceived exertion and effectiveness, build exercises habit, and normally the exercise habits like 150 minutes per week, and as well as meet to 60 to 80% of our heart rate. That is very important. So the timing is not an issue. Like at least they will go undergo 30 to 40 minutes. So that knowledge, that kind of knowledge, basic knowledge the patients are having about. The only thing is the target heart rate. So that is the problem, because people are missing in that. So they should think about their own maximal heart rate, and they should reach the target heart rate at 60 to 80% regularly. So that seems to be a very safer zone for doing the exercises. And we have so many evidence for this, and the available evidence suggests hybrid may provide an alternative options for the cardiac rehabilitation service for stable, low to moderate risk patients with CVD, and short-term improvements in functional capacity. So, and other of cardiac rehabilitation therapy appears to be better in hybrid compared with the center base. The result of the greater flexibility and convenience of the patients. So tele-rehabilitation is effective, safe, and is accepted by patients and caregivers. So we have so many evidence-based, supports. Supports are there for the hybrid variety of cardiac rehabilitation in tele-rehabilitation. And coming to the conclusions, so the cardiac rehabilitation is an important part of long-term management for the patients with the cardiovascular disease. In the era of COVID-19, as well as in advantage technologies and physical attendance to hospital may be restricted for the coming to exercises. So tele-rehab is a hybrid version for a future direction. So definitely, and it's an evolution of the rehab. And thank you very much for this opportunity. And I'll be very grateful for this opportunity. And thank you, IAP. Yes, ma'am. You have any questions?
The participants can write in their chat box so we can answer them.
Okay, ma'am. Okay. So thank you
So
very
we
much
can
for this
have,
opportunity, ma'am. Thank you, Pratibha, ma'am.
Thank you for joining, sir.
Thank you very much for this
Thank you.
opportunity, and thank you, IAP.
Thank you for
So once
sharing
again,
your
I'm wishing
time,
you
sir.
World Health Day of 2024.
Thank you, sir.
Thank you,
Thank
ma'am.
you. From PV Harahara Subramanian, it's given us informative session. Really, it was an informative session, sir. Thank you so much for your valuable time. Thank you so much for your presentation. Surely this would have been a knowledgeable session for everyone over here. And most of us will try to watch in IAP India YouTube channel also in further future.
Thank you.
Thank you so much.
Thank you very much.
Yeah,
Yes,
we can see that.
Sandhya ma'am. Well, so before the presentation, I'd like to introduce ma'am as well. Dr. M. Sandhya, MPT Ortho, PhD Assistant Professor from the Physiotherapy Department of Vistas. She is having a working experience of 10 years in teaching both UG and PG, and clinical experience of 10 years and research 4 years, currently guiding PhD scholars, and published total 19 papers in indexed and corpus journals, both national and international journals. Published 2 book chapters in online and received Faculty Excellence Award for 3 consecutive years of 2021, 22, and 23. Attended 60 plus conference and I have organized many conferences and workshops and have presented more than 15 papers in both national and international conferences. We welcome you, ma'am. You can carry on over your session. So I'll be helping you to move on the slides as well.
Thank you, ma'am. Thank you. Thank you for the warm welcome. Good afternoon, everyone. Happy World Health Day. First of all, extremely sorry for the mess and inconvenience created. So, without delay, let's move on to the session. Okay, I'm Sandhya, Assistant Professor in Vistas, Wales University. So, my topic is emerging trends and practices in orthopedic physiotherapy. New era in physiotherapy, and what are the advancements we have so far reached in physiotherapy in the field of orthopedics, say rehabilitation robotics, 3D motion technology, motion capture technology, virtual reality, telerehabilitation, wearable technology, and artificial intelligence. Next. Okay, so new era. So what is the advancement we have reached so far is like physiotherapy. It's a kind of dynamic industry where the importance of staying informed about the latest research cannot be understated. Actually, like sticking on to the old traditional methods and treatments like mobilization, manipulation, and using modalities doesn't work nowadays, because we need to go with the flow, and a lot of researches have been done, and a lot of new methodologies, practices we have reached new milestones. So we need to cope up with that and adapt ourselves to the new technology to give a valuable and effective treatment to the patients, and to have a beneficial for our therapists too. Next. So actually, this section aims to highlight some of the most recent advancements which is we have received. So we have received in the field of orthopedic physiotherapy. So today we are just witnessing an emergence of exciting new treatments that we have the potential to revolutionize the way we approach physiotherapy. So let's move on to the new techniques, what we have reached so far. So next is rehabilitation robotics. Next. So rehabilitation robotics, as we can see in this picture, ma'am, next, just click once. There is a therapist she is helping a patient who's a problem with a gait. So this is a kind of a robotics called exoskeletal robotics. It's especially mainly meant for the individual isolated movements improvisation. So there are actually two types of robotics we have. Ma'am, click. These are like instruments aided especially for the sensomotor functions. There are actually two types, as I said, end effector and exoskeletons. The picture which we are seeing right now is the exoskeletal robotics. As of end effector is meant, it's specially meant for the faster setup, and it's more adaptable for the patient. It's easy, adaptable to the patient. Whereas when we see exoskeletal types robotics, it's purely meant for the precise joint isolation and improved gait transparency. So there is unique advantages for both the robotics, which is currently used in the field. Next. So next new advancement which we have come across is 3D technology, 3D motion technology. Ma'am, click it, ma'am. Yeah, the picture which we are seeing is like a man is trying to jog or run. Here, the next picture which shows the 3D animation of that particular person, where the joint are placed, which angle he is standing, which are the joints is placed, force, and these are actually meant to detect the movement pattern in 3-dimensional view. Okay, actually, when we walk or jog, like where is the problem lying, whether which joint is problematic or which movement is problematic, which makes obstacle for the further walking, that we can identify with this 3D motion technology. Now click it. So to have an effective treatment, actually we should first see the root cause of the problem. Unless and until we find the root cause, we cannot give an effective treatment. So this 3D motion technology actually helps in a way of finding accurate root cause of that particular problem, whether which movement or which particular pattern of movement is problematic. So in that way, this 3D motion technology is improving or helping us in the assessment format. Next. So next is motion capture technology. Like many movies, we would have seen this, especially like CG, where they use computer graphics and all. So actually, what is this motion capture technology and how does it help physiotherapists? It actually allows the integrate motion analysis capturing in movement. So for a patient to have a specific muscle to be targeted, and that has to be trained specific. For example, in this particular picture, if you see, he's trying to work the quadriceps. Okay, so this, when we do this motion capture technology help, we take this help, so it actually tells us which muscle is particularly working. If you want to work only the quadriceps, you can prescribe the exercise only meant for the target, avoiding all the accessory movements. So it gives actually a live feedback. You'll get an immediate feedback where you can correct the exercise. If the muscle is not particularly targeted, then you can change the exercise and immediately you can see the effect, or see how the muscle is working, where it is working, and what kind of improvement you need to add, strengthen the particular muscle. So in that way, this motion capture technology is very much helpful in our field. So next is, next. Virtual reality. This you would have heard in many places. Even we would have played games and all. When we go to malls or any game areas, we would have wearing this specialized equipment of this VR, and we used to play games and all. No, it used to be like very realistic, but actually it is not. It is an imaginary one, and when we do engage ourselves in this virtual reality, any kind of programs or games which is pre-programmed, that is actually helpful, and it just stimulates the things which we actually wanted to do. For example, if there is a stroke patient, you want to activate his hand movement. So you can create a game such a way that he uses his hands. Okay. So how this VR is helpful means it actually distracts the pain or the other disability what the person feels actually. Right now in the picture we can see he has some problem with the lower limb. So the therapist is trying to give exercise or to initiate the movement in the lower limb. They have created like a football game. So just visualizes the game and he's just trying to put his leg forward. So in that way, VR is helpful, and VR is helpful in many conditions like you can see autism, CP, hypertonia, developmental delays, ankle sprain, like shoulder pains, back pains. Then you have cervical myelopathy and Parkinson's disease, chronic pain management, stroke, and even lot of other conditions where this VR is very much helpful nowadays. Next. So next condition is tele-rehabilitation. Tele-rehabilitation, we know actually this was very much useful during the pandemic time. Okay, so COVID time, we all were like in the lockdown phase. We couldn't meet even our neighbors. We couldn't, therapists couldn't go and meet like patients at home. It's a lot of less restrictions. So this Tele-rehabilitation was so much helpful that time. Actually, it has a good, bigger advantage where you can reach people even in remote places, okay, where they cannot come to hospital or a clinic for an emergency. Even that places you can reach through online or any kind of software mode. Here from there you teach them and they actively participate from their end. They actually they will be like an active partner instead of a passive patient. So you can train them in through online mode. As you say, give them the instruction, they actively participate. And it was like empowerment and self-engaging for them. It was so interesting and it was so much helpful during the pandemic time. So tele-rehabilitation, one of the biggest achievement which we have come across in the field of medical. Next. And it has one more advantage. I just forgot to tell you. It reduces the cost. It was very cost effective because they need not travel from their home and to reach clinic or hospital. And it was cost effective. It was time saving too. So travel they had no options that time. So pandemic time, it was very much helpful for them. So the next biggest achievement is wearable technology. So wearable technology, it's a kind of a gadgets we use almost in a home. At least if 4 or 5 people are there, one will have at least a smartwatch. So smartwatch. Smartwatch, it is not only meant for looking at the time. It also tells monitors your vitals. It tells you what kind of fitness you are engaging every day. Tells you how much of steps you have walked, and you can record your menstrual cycles and all, and like how much water you have to drink, even your glucose levels were monitored. So it has lot of beneficial effects only in the watch. And saying apart from the watch, we have headband, chest belt, smart rings, socks, like t-shirts, then you have shoes, and even eyeglasses. So all this is especially meant for sensing our movement patterns or the motions which happens in the body, and just gives us like feedback how much we have to work on it. Like everything is pre-fixed. And next slide. So the biggest achievement in the kind of field of wearable gadgets, you can see it was actually started from a single watch. Now it's the next generation will have t-shirts which can sense your body. Then you have patches, like you sticks one small patch in your wrist and you just walk with it. It actually monitors all your vitals, and end of the day you can see how much are your pressure, how much is your heart rate, pulse rate, SpO2, how much all this is recorded. And final stage is implantable, like how we insert a small chip inside the body, same kind of like fourth generation people, even they will have all this insertable chips inside the body that can that will keep like how much workouts you have to do, monitoring your vitals, your blood pressure, your glucose level, your cardiac functioning level, everything will be monitored. So starting from a small smartwatch, we're gonna reach like implantables in next. So that is a progression we have seen in the wearable gadgets. And last but not least is artificial intelligence. Like in any social media or in TV channels, if you see 4 or 5 ads, at least one ad will be of like telling something about this artificial intelligence. They will say this artificial intelligence, with the help of this, I have created this, that, even PPT, Word, anything you can create easily with the help of this AI. So how AI is helping us in our field? So it is actually a revolution in the field of health, and lot of awareness and lot of applications have been created in the last few years. and we have a remarkable progression and results regarding this artificial intelligence. Many clinics and hospitals I see now they have this artificial intelligence setup. Okay, so they are putting the patient in bed, and they are getting very effective and significant improvements in the conditions. Next. So actually, it is nothing but sensors which recognize the abnormal movement patterns during functional movement, and it can be of great value in the analysis of functional tasks. When a person is failed to do a functional task, these sensors will give you alarm, like it gives a signals that something is wrong with the body. Immediately you can correct it. And in concern with the tele-rehabilitation, virtual reality, and the gadgets what we use, all these are like, it's a kind of interlinked with the AI. Okay, so AI when a person your client or a patient does something wrong which you have not taught them, or the exercise he is doing is incorrect, immediately you can correct them and you can modify the exercise with the help of this AI sensors. So they will be having a software, and our therapist will have a software. So both is linked, and you can keep monitoring them, like regular follow-up you can have, and you can correct them whenever you want. Next. Next.
Yeah, trying.
So this picture is about pro robotic gait training. Here the therapist is completely
fine, ma'am.
Yes, ma'am. Giving the instructions, and the patient is able to get the command, and along with the instruction is just training his body. And this can provide consistent high intensity therapy, and their adaptability makes the suitable for wide range of patients. On top of that, they offer real time feedback, allowing for the personalized therapy session. So AI is so advanced and improved, and it gives like individually programmed sessions. You can give specified programs for each and individual. Next. So apart from all these advantages and effects, next slide. There are a lot of myths about this AI, misconceptions actually. So I just wanted to clarify that also. Many things that AI will replace a human therapist. Human therapist demand will reduce, because when all this is replaced by a machine or software, then we have no role. No, it is a myth. AI is just a tool which helps the therapist to provide a personalized feedback, monitor the patient progression, and make interventions more effective. Without us, AI will not work. So it's a myth that it will replace human therapists. No, it is not like that. The next is AI is too complicated and expensive for a rehabilitation setup. No, nowadays AI like artificial intelligence instruments and the softwares are more accessible, affordable, and easier to integrate in existing systems. See, before and all, we all were having a small mobile phones. Right now, if you see at home, almost everyone has an Android or a software smartphone. So we have advanced, right? Same way, in another few years, AI will reach everyone, and we can have a better improvement from that. Then it is not reliable. Many says it is not reliable. It is not like that. AI is designed in such a way, and it has come across many testing and multiple stakeholders and ethical consideration. After that, only AI is approved. So AI is a reliable one, and we can put a lot of we can get a lot of good improvement, significant improvement by using this AI for the patients. Next. So these are few resources. If you want to learn further about artificial intelligence, you can go on with this. Next. So embracing the new era of physiotherapy, like actually we should adopt the new technology which is available in the field and we just go on with the flow, and then only we can improve the patient outcome measures, and the treatment what we give the patient will be enjoying it. Otherwise, if we keep using the same modalities like ultrasound, IFT, manipulations, you give them exercises, only that will not work in the future. So we need to follow all the or go with the flow, what is newly advanced in the field. We should be updated. Then we can have a good, significant improvement and successful recovery of a patient. Next. So my take-home message is always updated with the knowledge in the field, in any field. We are in the physio field, so we should be updated with the knowledge, current trends, we should be updating it. And how to update our knowledge? Only when we attend a lot of conferences, workshops, webinars, CME programs, and reading latest journals can update ourselves. After updating, what we will do, we have to use all the study results should be checked with whether it is evidence-based practice. If it is working for a patient, definitely we can implement that with the other patients. So in that way only we can be updating ourselves in the field, and also we can give beneficial results to the patients. They will also be enjoying our therapy sessions. So thank you so much. So with this, I'm ending my presentation. Any queries, clarifications?
Anybody having any questions? Regarding the session? So I think it's time to end up the session.
Okay, ma'am, thank you so much, ma'am, and Sandhya sir, for giving me this wonderful opportunity to share my knowledge.
Okay, thank you. Thanks a lot for this wonderful session, ma'am. Actually, it was really informative, and we also have gone through how we can recollect what all the advancements are there. So we can also utilize it in our clinical practice, actually. Thanks a lot,
Thank you,
ma'am.
ma'am.
Thank you. So I would once again like to wish all a happy World Health Day 2024, and wishing you all that you all take home a message that what all should be implemented in future. So while practicing, if they are students, and for the practitioners as well, it would be very useful for this updates. And I would like to thank once again. I would like to thank our president, Indian Association of Physiotherapists, Dr. Sanju K. Jha sir, and Dr. Ruchivashni ma'am, our national head, Indian Association of Physiotherapists Women's Cell, and treasurer of IAP, and Dr. Janani ma'am, our state head, Tamil Nadu Indian Association of Physiotherapy Women's Cell. And I would like to thank our resource persons, Dr. Sandhya ma'am and Dr. Koushik sir, for making their availability at this time. And I would like to thank our HOD of Vistas, Dr. Sendil Selvam sir, and HOD of Meher, Faculty of Physiotherapy, Dr. Parthasadi sir, for making their faculties to participate in this Tamil Nadu IAPWC Kanchipuram district webinar on this World Health Day. Thank you all.